Hello everyone, I'm Emma Case, and today I will be presenting to you about a specific goal created by Healthy People 2030. Today's presentation will relate to the treatment of mental health disorders and substance abuse. To begin my presentation, I would like to define exactly what Healthy People 2030 is. Healthy People 2030 is an organization created by the U.S. Department of Health and Human Services. They have set goals for the U.S. to work toward and achieve by 2030, and this organization has been doing this every decade for several decades. The goal that I am going to focus on that was created by Healthy People 2030 is to improve mental health in the United States by the year 2030. And what I am going to answer is, how will this be achieved? In order to improve overall mental health in the United States, the objective being focused on is to increase the proportion of people with substance abuse and mental health disorders that get treatment for both. Many people struggle with mental health disorders and substance abuse at the same time, but will only receive treatment for one. The other simply gets brushed off as a side effect. This objective relates to finding accessible and simultaneous treatment for sufferers of both types of disorders. Up next, I have a few statistics that I have given to help you further understand how substance abuse and mental health disorders affect people in the United States. In my research, I found that 8.2% of adults aged 18 and older are affected by co-occurring substance abuse and mental health disorders, whereas only 3.4% of adults aged 18 and older receive treatment for both of these disorders. Now I'm going to explain mental disorders and substance abuse a little further. Mental disorders are a clinically important abnormal behavioral or psychological pattern presented in an individual. They can be acquired by people of all ages and populations, and estimates suggest that only 50% of those affected receive treatment for their mental illness. Without treatment, mental disorders like depression and anxiety can progress further until the consequences overcome the affected. Mental disorders can potentially affect one's physical health along with mental health. Substance abuse or addiction, on the other hand, is a pattern of drug or alcohol use that leads to significant problems and distress. It can lead an individual to become low functioning and, in many cases, lead to overdose. A few modifiable risk factors of mental health disorders and substance abuse include obesity, medications. Now, this can be a certain medication that a patient is on, and side effects can lead to both of these disorders, and a lack of access to resources, and I'm talking about early prevention help like counseling. Unmodifiable risk factors include genetics, chronic illness, and stressful life situations like family death, financial struggles, and poverty. There are a few ways to prevent these disorders from occurring within your life, and those include knowing and understanding the warning signs of both substance abuse as well as mental illness, routine medical treatment that involves medical screening for depression and anxiety annually to make sure that this will never be developing within your life. Implementing physical activity into your daily life can improve your mood and prevent the risk of mental illness. Getting involved in an extracurricular activity gives you a support system to prevent both substance abuse and mental illness. Limited substance abuse, not going out and drinking or using any illegal substances is one of the best ways to prevent substance abuse and becoming addicted. Promoting a healthy diet will make you overall healthier and limit the chances of both of these disorders occurring within your life. and also knowing the risk factors and avoiding the modifiable factors will prevent substance abuse and mental illness within your life. One treatment for mental illness is cognitive behavioral therapy, which is a type of treatment that works by helping people identify and change complex or repetitive patterns of thinking that are ingrained into the brain after several years. This allows patients to become self-aware and take control of their disorder. It teaches them to manage and detect patterns that are responsible for ineffective behavior. Guided discovery is another type of treatment. This type of therapy in which a healthcare professional will hear a patient's viewpoint and assist them in broadening their perspective. Both of these methods of treatment allow the patient to have control of their healing progress. One treatment for substance abuse is talk therapy, which is speaking with a healthcare professional, and this helps the patient understand their disorder and the consequences it can lead to. Therapists are there to assist the patient as they overcome their addiction and find what works for them. Group therapy is another treatment, and it's much like talk therapy, but with a group of people. This can be friends, family, or even anonymous. Another treatment is residential patient rehabilitation, where a patient lives in a therapeutic community to disconnect them from the outside environment and focus on the education of substance abuse and oneself. If you are struggling with either of these disorders, here are some local, state, and national resources to find help. You can find help almost anywhere, especially with how everything is digital these days. So searching a place near you will benefit you in finding a resource.